Alright guys, so today is the day, surgery day. I got my two little pigtails going, and you can see there's all the items on the bed that I need to get dressed in. So I'm gonna do that and I'll keep you guys updated. Hey guys, so this is it. This is the day for surgery, for the mommy makeover, my tummy tuck, and my breast augmentation. I am actually here in the waiting room. They gave me a heated blanket and everything, so just I'm sitting here waiting. You may notice like they marked me, right? Just so that they know that they took all their measurements and everything, so they know when they go in and start surgery, what has to happen, where to cut, that sort of thing. Very nervous, but I'm very excited. This doctor's track record for mommy makeovers specifically has been phenomenal. So, I mean, I am going into this very confident that the results would be just superb. So I just wanted to share this with you guys and just let you know that today is surgery day. I am in a room, just a simple room. That's the bathroom door there. That's the entrance to in and out of the room. HGTV. And just a simple little area. So as soon as my operation is done, I understand I'm going to get put into a recovery room. And while I'm there, they will call my husband to come get me. So this is it, guys. All right, I'll keep you posted on everything that's happening. Hi guys, so this is 5 days post-op for my mommy makeover surgery. So yes, my surgery was a success. I just want to share this with you guys. So obviously, just laying this out there, if anyone is squeamish with blood or any blood related, anything like that, you know, that you're seeing and you're gonna freak out, pass out, I suggest you skip forward to this video, because I am actually gonna share my progress with you. All right, so for all of you who are following me would be aware that I did the mommy makeover, which is the tummy tuck with breast augmentation and liposuction on my flanks. So as you can see, let me just adjust this really quick. So as you can see, I went from you can't see, I went from a size A to a C. Right now the implants are sitting kind of high, which is normal. They're going to sit high for a bit until the muscle relaxes and it settles down into the area, right? And then it looks a lot more natural. I did read up about this prior to getting into, the surgery. All right, next thing is I'm just drop the camera just a little bit so you guys can see. All right, so these beauties are my JP drains. Now you see I have them, it's kind of tucked into my underwear so it's not, dangling all over the place and getting caught on anything. That's just me. So right now I have these, one on my left side, one on my right side. One is actually it's inserted into the skin where the, just kind of in line for where the actual suturing took place when they pull the skin down after for the tummy tuck. And basically what it does is it releases the excess fluid and it comes through these tubes and goes down into the bulbs here. And basically what they tell you is that in a 24-hour period, if there is any, the fluid fills to more than half, just make sure get it emptied. each bulb on the side, there are measurements that actually shows you how much fluid is actually in that area. I am still having to walk a little bent over, only because, you know, I have to have this kind of hunched over walking. I didn't need a walker. I didn't need you know, any sort of thing to help me, any sort of walking apparatus to assist me. I was pretty much up and walking from when I got up from sleep the day of my surgery on Friday. So the next day I had to go in and just make sure my dressings and everything, you know, they were fine, and my wounds were healing well, or started on the healing process. And they did actually indicate that, you know, I was healing really well, and the healing process has started really, you know, really good, and my wounds were well. It wasn't anything, you know, weird or anything that needed emergency attention. And I was walking fine to go into the room and everything, and they were very much surprised that I did have that much energy and strength to, you know, be able to move around. So like I say, I still have to have this slight bend, you know, bend over while I'm walking, still kind of slightly hunched over, so you guys can see, just kind of, you know, just a slight bend, nothing too crazy. But one of the things that they're talking about, this area right here, is where I'm feeling a lot of aches and pains in my back, and mainly it is because I have to be hunched over. Only when I'm walking. If I do have to stand for an extended period of time, I feel it a lot more. But if I'm sitting down, I'm fine. It's just, I guess, with the weight that I have to, you know, when I'm standing. I want to say in about 2 weeks' time, I should be well enough to like stand straight up without having to worry about, you know, stretching and undoing the sutures and all of that. So, I mean, I can stand straight up right now. I just don't want to risk it. I would like to give my body the time to heal. So a couple of things I want to touch base on is, in a previous video, I did mention my incentive spirometer. So I did use it. And I can tell you, when you do any sort of surgery, tummy tuck, anything that restricts a simple thing as taking a breath like that, you realize how many things you kind of take for granted. And I say that because it was a struggle taking a full deep breath in my lungs without feeling any type of pain. Now remember, I said that the tummy tuck, the Mommy Makeover tummy tuck, they fix diastasis recti. That's the extension of the abdominal wall when you have children. And once that opens and expands, there's no way for it to, you know, get back to its normal self. And the only way that they can fix it is because they have to stitch it and get that back in alignment, and that's how you get it like nice and flat, right? Well, the surgeon spoke with my husband, and he actually explained to my husband exactly what was going on with me, and it kind of helped both of us to realize why, you know, with diet and exercise, I was still having that struggle. So I have 4 children, and my last 2 pregnancies were, I want to say, not as easygoing as I thought my other 2 went. And basically it was described my abdominal wall, and when he opened me up, sounds weird to say that, but when they, you know, he got a look on the inside, he saw that my abdominal wall, it was extended so much, it looked almost like a globe. So that's why my upper abdominal area was always high and almost rounded. So it gave me the look as though I was always pregnant or expecting. It didn't matter what I wore. It would always, look that way. And I felt relieved to know that that was the issue, and it wasn't just, me forsaking, exercising and all that. Now, I don't junk eat. My husband would disagree, but I don't junk eat. But admittedly, I didn't really calculate my calories to say that I would follow like a strict dietary regimen, So basically what was happening was my entire abdominal wall. So basically my abdominal wall was stretched out because of having my last 2 kids. And now that I understand why and was able to, get the respective surgery to get that fixed, I am happy. I can tell you that right now, obviously, I am still a bit swollen, so you may not be able to see it. But I was told that I can, shower, and I can take the binder off and shower with an antibacterial soap. So I have Dial antibacterial soap, so I'm going to use that. And I can shower, and I can put back on everything. I can change the bandage padding that they have over the sutures. I can swap that out for like the maxi pads that I had mentioned that I bought. So I'm going to do that. I am going to actually use some Neosporin and put it on the area, just so that it makes the scar area, it's not too dry and it doesn't get stuck to the bandage, because pulling that off is going to be a pain. So just want to make sure all that gets taken care of. I want to say on a scale of 1 to 10, pain management for me, I want to say was like a 6. Everybody is different. I didn't really have to use much of the pain medication that was prescribed to me, so that's a good thing. I am still taking the antibiotics because it's a 28-day course and I need to take that. I need to make sure that that is taken and completed, basically. And so my drains come out next Tuesday. They did say that if there is a quantity of less than 25 cc's in the bulbs in a 24-hour period, that the tubes can come out. So I'm actually going in next Tuesday to get that taken out. I'm excited about that, mainly because it's like a pain right now. It's just very annoying to have these on the side, because I mean, I know that they're there and I know why they're there, but I think they can come on tomorrow. But I mean, I'm not the medical professional, right? So I just wanted to give you guys this quick update and just show you that my surgery has been a huge success. I am actually awaiting the facility to email me my before and after pictures that they do take. It is part of my medical records, so I requested those, and I'm waiting on them to compile them and send them to me. And if you've ever done any type of surgery and you want those pictures, they are yours. They are part of your medical records, and the facility cannot tell you that you cannot have it, just so you're aware. You know your rights as a patient. So I have requested mine, so I'll definitely go through them and share in my next video. I think I'll do my next video when I get my drains out, and I can definitely get a full picture so you guys can see my results thus far. So again, thank you so much for watching and staying tuned and following me along on my mommy makeover journey. I'm so glad to take you guys along with me. Keep good, stay blessed, and enjoy the rest of 2022. Bye.